Now to a very important topic. It's not necessarily easy to talk about, but it's something you should. Substance abuse, particularly when it comes to your teen. Chances are they're under tons of social, academic, and cultural pressures. You talk with them, you may be helping more than you can imagine just with a conversation. Here was some encouragement about talking with your teenagers on substance abuse and just everything in general. Dr. Angela Sanchez from the Lovelace Medical Group. Good morning, Dr. Sanchez.
Thanks for inviting me.
Good to see you. Okay, so the issue of just talking with your kids in general, do you find that parents probably don't do it enough for whether it be the parents are busy, the kids are busy, or anything?
I think that's probably true. Sometimes, you know, it's difficult to talk to your kids about risky behaviors.
Yeah.
It's scary, but probably one of the most important things that you'll ever do as a parent. I would say as important as teaching them how to cross the street.
That important.
Well,
all right, you're a mom. You have 3 daughters. You know this right. Just as well as anyone does.
Right.
Okay. So let's talk about this. Do you start having a conversation with them about substance abuse, say at a certain age, or maybe when you think something is wrong? What's the best way to go about doing this?
I think starting an early foundation with talking about risky behaviors in general, back to that crossing the street idea. With small kids, it's okay to teach them just say no to smoking, drugs, alcohol, and other risky behaviors.
At some point, that's not going to work, though.
Well, the just say no message needs to be expanded when they get older to how to say no.
Sure.
What happens if a friend, a good friend starts to use drugs? How do you respond? What happens if someone you really like and respect is smoking?
Sure.
How would you handle that? So those are the kinds of dialogues that you need to open with kids as they get older.
What happens if kids are kind of closed off to this idea? I mean, I've been there. You don't want to hear it.
Right.
And maybe they're just non-responsive.
This is not a one-time conversation, and I will tell you that just like, you know, children are going to have to be receptive to the idea that their parents are going to talk to them about things that are uncomfortable.
Okay.
The parent is going to have to get some practice. So it's not a one-time conversation. You'll get better at it as it goes. And what happens is you build a relationship with your child so that they know they can come to you as situations occur, because they will.
I think I think that's the key that you just mentioned right there. Build a relationship so that they can come to you and they know they have an open relationship. Right. Okay, so let's talk about warning signs. Maybe a teenager may be experimenting with some drugs, going through a tough time. How do you know as a mom or dad, particularly when maybe they aren't in tune with their kids as they should be?
So, first of all, you need to know your children. You need to know where they're going, how long they'll be gone, who they're with, and what they're doing all the time. And that helps them to know that you're paying attention, first of all. And you mentioned some warning signs. So things like children being withdrawn, changing groups of friends, you know, changing in sleep patterns, appetite, grades, those kinds of things. They may be totally normal teenage behavior, but they also may be signs of substance abuse or even what we call a co-occurrent disorder, something like depression or anxiety.
Is there a way to tell the difference just at the forefront here, or do you have to really dig deeper to find out?
I think digging deeper is really important. And again, you know, some of these behaviors are normal. You know, a lot of kids kind of withdraw when they're trying to find themselves as teenagers. And so you want to really understand your child so that you can see if something changes and then seek help if you need it.
Okay. I was just going to say, so what do you do if you find, the obvious way to find out if your kids are doing drugs, or if you were, say, to find a little bit of marijuana or some prescription pills? Unfortunately, kids are doing a lot of that. What do you do if you're mom or dad and you find this, say, in your kid's room? And I guess the first question is, should you search your kid's rooms?
That's a hard question.
It's a very hard question. Should you search the rooms if mom or dad suspects it?
I think that if you suspect, you need to dig in. And I can tell you as a family doctor, I see lots of families who are dealing with substance abuse in their teenage children. It knows no boundaries. It's not about culture or creed or socioeconomics.
Rich, poor,
there are children all over this city.
Race or ethnicity.
It's
does
not about that.
Matter.
No.
Okay.
So you can't think that you're safe simply because your kid's at a good school. I think digging in is a good approach.
Okay. So you find the drugs. What do you do? How do you deal with it?
I would say consult a mental health professional. Your pediatrician or family doctor can help you to try to figure out what the next steps are. It's complicated and difficult, so hopefully people can start these conversations long before they ever get there.
And also, I know there are over-the-counter drug tests now I think you can buy.
That's true.
Good, bad thing?
I think it depends on the situation. But, you know, if you know your children and start early, then hopefully less families will face these circumstances.
You keep going back to that. Know your kids, start early. It's not going to make everything better. It's not going to solve a problem, but it's certainly going to help.
Well, build that foundation so that your kids trust you and you can trust them.
Okay. Dr. Angela Sanchez, Lovelace Medical Group, thanks for the advice. It is very good advice. It's a tricky topic.
The hardest thing you'll ever do as a parent.
I can't imagine having kids. You have 3 daughters to deal with that with. Wow, that's a lot. Thank you very much. It's good to talk with you.